So today we have recorded 40 new COVID-19 cases. 21 of these can be linked to known cases or ongoing clusters, with the remaining 19 still under early investigation. 9 were in quarantine during their whole infectious period. 10 people spent some time in the community for at least part of their infectious period and may present a risk of transmission to others. To 8 p.m. last night, we had 16 people in our hospitals. There are 6 people in the intensive care unit, with 5 requiring ventilation. On the vaccination front, almost 97% of Canberrans 12 and over have received a first dose, and more than 68% are fully vaccinated. Second doses are now outpacing first shots, with around 1,000 more second doses being administered in ACT government clinics yesterday than first doses. Yesterday was a big day for testing. More than 4,800 tests were conducted, which is the highest number we've seen since August. I'd again like to thank Canberrans for coming forward to get tested. This gives us a high level of confidence that we are accurately tracking the spread of COVID-19 in our community. And again, the reminder that if you have been to an exposure site or have even the mildest of symptoms, please do come forward to get tested. In relation to compliance activities, these are continuing across the ACT. Police yesterday conducted 83 in-person compliance checks of homes, hotels and businesses and stopped 538 drivers to speak with them about the current health orders. 6 people were directed to leave the ACT. No infringements and 1 caution were issued. I want to touch on a couple of matters before I summarise and hand over to Dr. Coleman. Firstly, I want to acknowledge and publicly note that there has been a significant impact of this outbreak on the local Aboriginal and Torres Strait Islander community. This is a reflection that Aboriginal and Torres Strait Islander people are in all walks of life in our community, and just like the rest of the community, there has been an impact on Aboriginal and Torres Strait Islander people. But we know that Aboriginal and Torres Strait Islander Canberrans are more likely to have underlying health conditions, and so this is a significant concern. And I do particularly want to thank those community-controlled organisations who have been working with us, not only to respond to cases and close contacts and ensure that they are well supported, but also to ensure that our vaccination rollout for Aboriginal and Torres Strait Islander people is being as effective as possible. That of course includes our partnership with Winunga Aboriginal Health and Community Services, but also Yedongmurra, where a vaccination clinic pop-up was held just the other day, and we're also having one on the north side at Gungahlin Salvos, and working with community to ensure that people are engaged in those activities. I want to also thank those from the ACT Health Directorate and Canberra Health Services who've been working really hard with our community partners to ensure that we respond in a culturally appropriate way to cases and contacts, and in terms of the vaccination program rollout as well. A brief update on the special care nursery cluster. There have been no additional cases associated with the special care nursery exposure at the Centenary Hospital for Women and Children. Investigations into the source of the infection continue, but we have confirmed that 2 carers who had been visiting the unit have tested positive for COVID-19, which I think I mentioned yesterday. We've also confirmed that the team member who had tested positive had cared directly for the first baby that was identified as a case. The team member is fully vaccinated. Both babies are now being cared for in a paediatric COVID-19 ward. 5 other babies have been assessed as close contacts and are therefore now in quarantine. I acknowledge this is an incredibly challenging and stressful situation for their parents. Carers will be able to visit these infants after they return a negative test on day 5, which I understand today is day 4, and they'll be being tested today. Visitors, of course, will be required to wear appropriate PPE and follow infection prevention and control measures. There are currently 27 Canberra Health Services team members who are unable to work as they are in quarantine as a result of this exposure. Plans have been implemented to minimise the impact on service delivery. Our COVID-19 exposure team is continuing to conduct and act on comprehensive risk assessments during this evolving situation. Enhanced infection prevention and control measures and protocols have been put in place to further minimise risk, and impacted areas are being deep cleaned. Non-essential movement in and out of the special care nursery and the neonatal intensive care unit is being limited. So in summary, for those who joined late, today we have recorded 40 new COVID-19 cases. 21 can be linked to known cases or ongoing clusters, with the remaining 19 still under early investigation. 9 were in quarantine during their whole infectious period. 10 people spent some time in the community for at least part of their infectious period and may present a risk of transmission to others. We have 16 people in our hospitals as of 8 p.m. yesterday, with 6 in ICU and 5 requiring ventilation. And with that, I think I'm handing over to Dr. Coleman. Yeah.
Good morning, everyone, and thank you very much, Minister Stephen Smith. So, on today's numbers, we have 40 new COVID-19 cases that have been notified since our last update. This brings the number of cases in this outbreak to 1,147, with the total number of recovered cases now 711, or 62% of the outbreak cases. We continue to manage 430 active cases. So of the new cases today, of the total 40, 21 can be linked to known cases or ongoing clusters. And out of these 21, we know that 15 are household contacts. So household contacts continues to be our predominant method of transmission. Out of the total 40, 9 were in quarantine during their whole infectious period. And of those we have assessed, 10 people spent some time in the community for at least part of their infectious period and may present a risk of transmission to others. To 8 p.m. last night, 16 people in our hospitals. 2 are fully vaccinated, 11 are unvaccinated, and 3 have had 1 dose. There are 6 people in ICU, with 5 requiring ventilation. Before I finish up today, I did want to remind people that we continue to have over 400 active exposure locations in the ACT. So please keep up to date with these. If you have been to an identified location, check on the website and follow the relevant public health advice. And my shout out today does go to the ACT Health and Canberra Health Services staff who are running our pop-up vaccination clinics. These pop-up clinics are actually a really critical part of a vaccination program, and they've been evolving as we monitor where our potential gaps in vaccination are. So we're trying to provide as many opportunities as possible for people in our community to get vaccinated. I know, because I've met some of them, that these teams are full of people who are really, really passionate about our community and are working closely with community leaders and our community service providers to encourage and support vaccination for sometimes some of our really hard to reach members in the community. So this is a really important part of our COVID-19 response to help ensure that our transition is as smooth as possible. So thank you very much to all of those for their work. And I'll hand over to Minister Berry.
Well, good morning everyone, thank you. I know that we've been through a difficult time already through the last 8 weeks of lockdown and another 6 or so weeks of remote education. And so I do want to take the chance today to say thank you and acknowledge all of the kindness and compassion and support and hard work for our school communities during what has been a really challenging time for young people, teachers and parents and carers. But we have been facing this challenge together, and it really is a testament to our school communities and Canberra on the strength of our community to be able to stay the course. I know that the weeks and months ahead that we will continue to support each other through another period of adjustments, learning to live with the continuing challenges that COVID-19 presents. Over the last 8 weeks, the ACT government has progressively been charting a way through ensuring that Canberrans are protected and that the risks associated with the continued presence of this virus in our community are mitigated to the fullest extent possible. As both the Chief Minister and Minister for Health, as well as the Chief Health Officer have been saying throughout this time, ensuring as many Canberrans as possible are vaccinated is a huge piece of getting through this puzzle. However, at this stage, there are still a number of people in our community who are unable to be vaccinated, and this includes children who are under 12 years of age. And it is with these people in mind that we have developed the plans for a return to on-campus learning that has commenced this week for some college students. A couple of weeks ago, we announced the plan to return to school, informed by the latest health advice from our wonderful Chief Health Officer, Dr. Karen Coleman. That plan foreshadowed a host of supporting measures to mitigate risk and to keep staff and students as safe as possible in the context of the ongoing presence of COVID-19 in our community. So to that end, today the ACT government has announced an additional funding of $5.7 million for Term 4 to make sure that we're doing everything that we possibly can to implement the health advice in relation to the prevention of COVID-19 in schools and in our early childhood settings. Through our conversations with our school communities, we heard that everybody wants to get back to school, but we all want to do it safely. And of course, school communities want to know how the ACT government is going to make it safe. This funding is all about making sure that schools have what they need in place that the Chief Health Officer has told us is really important. So the detail of this funding includes spending $2.9 million to improve ventilation in ACT public schools. This includes a range of activities including building works, CO2 monitoring, increasing the maintenance of heating, ventilation, air conditioning systems, funding for an anticipated increase in electricity bills. The AHPPC and the Chief Health Officer have told us that increasing fresh air is really important to mitigating the risk of COVID-19. The funding also includes $1.5 million for additional relief teaching hours to support public schools to implement these COVID-19 measures, including staff absences and enabling staggered breaks. We're also spending $688,000 on masks. Masks and hand sanitiser will be provided to public schools, early childhood education and care services, including out-of-schools hours care services, and for low-fee paying non-government schools. And so that students can learn in outdoor spaces, we're also investing $500,000 to get started on building additional shade structures in ACT public schools. We also know that the impact of COVID-19 wellbeing won't end when the lockdown ends. So we're increasing the capacity of our telehealth psychologist service for public school students. The most important thing that we're doing so far is to make sure that everybody in our community who can get vaccinated does get vaccinated. Our teachers, educators and school staff are doing just that. This is particularly important for primary schools and early childhood education and care settings where children can't yet get vaccinated. The Chief Health Officer has told us that the best thing we can do to keep these children safe is to make sure that adults around them are getting vaccinated. So just to remind everybody, the health and safety measures that will be implemented in our schools prior to young people returning and their school staff. We are encouraging everybody to get vaccinated who can get vaccinated, making sure we use the Check in Canberra app, improving ventilation by maximising fresh air outside, physical distancing measures for adults as much as possible, mandatory mask wearing for staff across all schools and for students in years 7 to 12. Limiting the mingling of student classes and year groups as much as possible. Staggering breaks. Increasing the use of outdoor spaces. Limiting on-site visitors. Environmental cleaning. And of course, not allowing anybody with symptoms to enter the school. All of these measures are important to ensure that there is a safest possible return to on-site education. Our teachers and school staff have been working really hard during this week to continue the remote education and to get ready for students to return to campuses in the current week. As always, I want to thank everybody for their patience and for their resilience. This is a really tough time. And good luck, of course, to our Year 12 students who will be sitting their AST exams next week. Now, I'm happy to take questions, but I'll hand over to the Health Minister, Rachel Stephen-Smith.
Hello, Caspar.
Minister, regional travel is set to resume in some capacity in New South Wales from Monday.
Mm-hmm.
Is the ACT government concerned about Canberrans heading over the border to access activities in New South Wales which are not yet permitted in the ACT? What will be done to address that? And is there more clarity coming over the border arrangements with ACT and New South Wales?
I guess the question of what will be done to address ACT residents travelling to New South Wales is really a question for New South Wales, because ACT residents' travel to New South Wales is restricted to some extent by New South Wales. I would note that their pathway does enable travel within regional New South Wales, but not between Sydney and the regions. And so I understand that we are, I certainly haven't seen yet, but I understand that we are getting some advice from the Cross-Border Commissioner about what that will mean for the way New South Wales treats ACT residents. In our own roadmap, we have said that we will look at restrictions on regional travel from the 29th of October. But I know the team is also working, and Dr. Coleman might be able to provide some further detail about the thinking on this. I know the team has also been thinking about how we look at a slightly wider region than the current postcodes that we've identified, and whether we relax some level of travel restrictions between the ACT and those postcodes, that wider region, whether we do that in relation to the region as a whole, or whether we do that in relation to some of the things that we know have been causing particular concern for people in terms of being able to see their family and their loved ones, but not then necessarily tourism type activities. So those are the things that we're currently working through. At the moment, we don't have all the detail around that, but we'll continue to work on it, and we'll let people know any changes, obviously, as soon as we can.
Minister, if New South Wales reaches 80% double vaxxed over 12 before the 29th of October, that'll mean they've achieved the same benchmark that we've set. Wouldn't we then be able to open up travel?
So a couple of things in relation to the way that we have set our roadmap forward, or our pathway forward. We have been really clear that we want to provide certainty as much as we can to people, but we also want to take a cautious and measured approach out of the lockdown. I think the Chief Minister has made the point on a number of occasions around full effectiveness of vaccination, and we've also made the point that we want to ensure that while we have high vaccination rates right across the community, we also have given all of those people who don't necessarily have as good access to mainstream health services the opportunity to be vaccinated. So we want to ensure that those more vulnerable members of our community have that opportunity to be vaccinated. So we're taking all of that into account as we set our own pathway forward. And obviously there has been, for the last 18 months, some ups and downs between the restrictions in the ACT and the restrictions in New South Wales. People have managed to work through those and will continue to do that.
Minister, just on the borders again, from Monday, how concerned are you about the management of border compliance, say when Queanbeyan residents can travel to the coast and then come back, show their licence that it's got the Queanbeyan postcode and then travel into the ACT?
Yeah, look, obviously there are going to be some issues around that, but people generally have been pretty compliant and people know what the rules are in relation to those standing exemptions. And so the standing exemption applies if you haven't left that border region. If you've been in other parts of New South Wales, that means the standing exemption doesn't really apply to you. So I think people do need, if they live in those postcodes around the ACT, do really need to take into account what our rules actually say and make sure that they are complying with them. We're obviously seeing more cases in southern New South Wales, local health district, including in Queanbeyan, cases in the ACT, cases in Cooma, cases in Batemans Bay. There will come a point where there's not a lot of point in restricting that travel within our region if we're kind of seeing cases bubbling along both in the ACT and in our surrounding regions and potentially seeding backwards and forwards already. But those are exactly the things that we're working through.
Minister Atagi's recommended a third dose of a COVID vaccine for individuals who are severely immunocompromised. Where does the ACT stand on, I guess, getting work underway on that?
Yeah, so we were absolutely expecting that would be the recommendation from Atagi. I think they've flagged it previously and the team is working to look at how we will implement that.
Minister, how come the message about the Indigenous community and the pandemic came today, 2 months into lockdown? Has something triggered that? Has something happened? Is something being forecast?
Yeah, look, I think it was actually a conversation with Julie Tongs, the CEO of Wananga Nimitajar. It's always a bit of a balance for some of these things when you start talking about the impact on communities. We've talked before many times about both. There has been a direct impact on Wananga of cases there and Wananga being closed for a couple of days. We've talked about the vaccination rollout for Aboriginal and Torres Strait Islander Canberrans in the past. I think it was an increasing level of anxiety from people in the community that they were hearing about a higher number of cases. And I think we're at around 90 cases that are Aboriginal and Torres Strait Islander people in the community, most of whom are not vaccinated. And that's why we're putting a lot of effort into really ramping up our very specific culturally appropriate messages, but also access to vaccination for that community. But people were obviously hearing about friends and family who were cases or who were contacts and wanting to know what was going on and wanting us to talk about it publicly. So there just comes a point where it is important to acknowledge publicly that there is anxiety in the community, and then also to acknowledge the work that is going on with community leaders to address the impacts of both the cases, the contacts, but also the vaccination program.
Vaccination rate for Indigenous Canberrans?
Just give me a moment. I had that in my folder yesterday, and here we go. So the latest data that I have is from the 4th of October, so it's reasonably recent. Overall, the population with one dose from 12 upwards is 74.4%, and the population covered with 2 doses is 51.4%. And we are seeing a lot higher rates than that in some older population groups. So once you get to over 35, it's pretty high levels, up and down a little bit. In some of our younger age groups, it's not quite as high as we would want to see. In the 12 to 14, we've got really good take-up, so 56% with a first dose coverage. But still, again, not as high as the wider population, and that's why we're really putting that effort in with our community partners to do in-reach and pop-ups and really encourage people to come forward and get vaccinated.
So that rate is 20% below, less than the non-Indigenous community, and also 90 cases sounds like an overrepresentation. Are you confident that the communication and the health messaging has been adequate for those groups?
Yeah, there's been a lot of work put in with community leaders, with specific videos being done and provided, and a lot of outreach. But this does reflect, well, the overall number reflects in part the fact that the Aboriginal and Torres Strait Islander community skews younger than the broader population. And so those lower rates in the younger population will have more of an impact on the overall population rate. But also that Aboriginal and Torres Strait Islander people don't necessarily have as high a level of trust in government and in mainstream health services. And that's why we've been working with Wananga, with Googangulwin Youth Aboriginal Corporation, with Yedong Murra, to try to reach those people who wouldn't necessarily access a mainstream service or make an appointment at a vaccination hub. And that's one of the reasons why, we're going to continue the steady pathway forward to ensure that all of that outreach and that really intensive work that's underway has an opportunity to take effect.
Shows a gap. What's going to be done differently now? Like, does stuff need to change?
So there's a lot of work with the community right now, and we'll continue to do that work.
Minister, how confident are you in the denominators we're using to calculate our vaccination rates? We've heard some experts say that the ACT's high vaccination rates are great, but they could be a bit rubbery given the small size of our overall population.
So there's work going on to understand better both the denominator and the numerator. So on the denominator, there are a couple of data sources that are used. It's mainly Australian Bureau of Statistics population projections data, and the one that's been used, from my recollection of a conversation, is the March 2021 projection. But there's also Australian Immunisation Register data that is a little bit older than that. They're not actually that far off of what we would expect from our projection for July 2021 or June 2021. So the denominator we are still doing some work on, but the differences we're talking about are, a couple of thousand in the overall population of sort of 430,000 odd. The numerator has had some issues. So there was at one point identified that there is a postcode on the Australian Immunisation Register that is kind of no address, not known type, a fake postcode, effectively, that is then allocated to the ACT. So that's been picked up and we're seeking to address that issue. But we do want to understand the data and to ensure that it is as correct as possible, because obviously once we start getting to over 100% of the population vaccinated, there's something wrong with the data.
The cohort of people aged 20 to 24, 74.5% of them have had a first dose. They're now the least vaccinated cohort of any in the ACT. 16 to the 15-year-olds and the younger people have overtaken them. Is there any work underway from the ACT government to target 20 to 24-year-olds specifically?
Yeah, we're actually just having a conversation about that in my office this morning, and I was talking to my colleague Michael Pedersen, who's much closer to being a young person than I am, and about what this, what more we might need to do, particularly I think to try to get messages through to young men who are not on our social media channels, who are probably seeing messages that are, a little bit different from what we'd like them to see in relation to vaccination. I would note that other than New South Wales, our rates of vaccination in that age group, the 20 to 24, are higher than anybody else other than New South Wales. And they've obviously provided a bit of incentive about vaccinated and unvaccinated people. So we're definitely doing some work to think about how we can better target that age group and break down the gender and look at the gender breakdown there as well, and whether it's particularly young men or young women or both that we need to target and how we do that.
Would you be concerned that that cohort is the most susceptible to vaccine hesitancy misinformation?
Yeah, I think it's probably an issue around they're not necessarily accessing government sources of information, and so how do we get into the places where they are, and also probably for that age group, for the younger age group, their parents are more likely to have helped them make a vaccination appointment. For that younger age group, they're not necessarily going to go online and find their Medicare card and go online and register and make an appointment. So also, how do we do more pop-up access, more access to vaccination clinics that don't require an appointment? So that's exactly the kind of thing we're thinking about. How do we do more walk-in capacity? And I know that the business community has been doing some of that, and Fyshwick Business Chamber in particular has worked with a number of organisations to organise those no appointment needed AstraZeneca clinics. We're looking at definitely doing something like that for Pfizer as well.
Just on the issue of fit testing, which was addressed in some detail in the Legislative Assembly yesterday, 2,500 clinical staff have been fit tested. What's that as a proportion overall of clinical staff? And understand that fit testing only applies to a certain type of PPE. Where is the use of that PPE determined to be required, and has that changed in the outbreak conditions in the ACT?
Yeah, so you're right. Fit testing only relates to the P2 N95 masks, the kind of which we're familiar from bushfire talk, but without the valve associated with it. So there are a range of different types of mask, and one of the issues around fit testing is which type of mask is the most appropriate for you. I can come back to you with the numbers of how many frontline clinical staff we have across Canberra Health Services. So the number that you provided, that 2,400 plus of clinical staff having been fit tested, is for Canberra Health Services, and there's another 715 from Calvary Public Hospital as well. They're also undertaking fit testing. So I don't have the exact number of clinical frontline staff. Canberra Health Services itself has about more than 7,000 staff.
Is Dr. Coleman available, unless there's other questions for the Minister?
Excellent.
Thanks.
Good afternoon.
Good afternoon. Dr. Coleman, there were reports yesterday that the tweaks that were made to the New South Wales roadmap out of lockdown had the Chief Health Officer of that state sidelined. We're a jurisdiction that's in New South Wales, and as our Chief Health Officer, how do you feel about that?
Oh, look, in this jurisdiction, the engagement between myself, Cabinet, as well as all Director-Generals across the directorates have been very fantastic. I couldn't have hoped for more engagement, and it's continuing to work very well. I think I will note this is a really difficult transition time. There are many competing factors, and I think I'm very pleased to be a part of the ACT's response in this case.
But New South Wales does have a heavy bearing on the ACT. How do you feel about those changes that were made yesterday in New South Wales?
Oh, look, I think that we're having a look at the changes to see the implications for the ACT. I guess they're twofold. One is about looking at cross-jurisdictional consistency for local community members, which I think you've already discussed with the Minister. I guess the other one is what the impact that might have on our own health system capacity. So all I can say to that is that we will be updating our planning and our projections around whether we think there's any increased risk associated with that, and continuing our conversations.
Dr. Coleman, the Chief Minister announced yesterday that fully vaccinated MP, senators and staff from COVID-impacted areas won't be required to do a fortnight's quarantine ahead of the October sittings, but unvaccinated will. Can you, I guess, just explain or go through your decision-making process for that?
Yeah, so we're in a transition time, and as we've been talking about, how we deal with travel in and out of the ACT is a really challenging aspect of this. Parliament sitting has always been considered an essential activity, and we've always managed parliamentarians and their minimum number of staff coming in under the essential worker potential criteria. So this has given us an opportunity to consider how that essential criteria might change or be adapted to recognise vaccination status, and also just as how we manage that with a new process to make it a little bit more streamlined. So So I think the Chief may not have given the details around that, but the best practice guide has been confirmed in consultation with the Chief Medical Officer. How we're approaching this is that vaccinated parliamentarians and their staff members who come from COVID-affected areas can potentially come in without quarantine, but still will be required to either undergo stay-at-home conditions or full quarantine, but attending Parliament House as part of their essential worker status. Previously, we've been very concerned about that because Parliament House is considered a high-risk setting. It's actually a lot of people in a location, particularly some of those chambers in those rooms, and people coming from all over Australia. So for that very reason, we've been very careful with Parliament House, and I think this stepped approach of considering vaccinated individuals an alternate to the full 14 days quarantine, but still protecting the Canberra community by having those outside of Canberra House additional mechanisms in place.
Sorry if I missed this, but were any of today's 40 cases linked to the Calvary Hayden nursing home?
No further cases from there.
On the changes with Parliament House and essential workers, if that model works well, could you see that being expanded to other categories of essential workers seeking to come into the ACT?
So which aspect of any particular aspect?
Not having to quarantine, stay-at-home orders, but being able to access your essential place of work.
So we absolutely provide exemptions under essential worker category already, and already consider them in a risk-based approach based on vaccination status, even though we might not necessarily be explicit in our communications about this. Very rapidly, this will become much more important, probably not at the end of lockdown, but certainly at the end of October. We are looking to how we manage travel moving forward and probably look at a more refined approach where there is a much higher risk of COVID being introduced from particular LGAs. So there's still a little bit of work to be done about that. And I think we've also talked about where people are vaccinated, were unvaccinated, and our public health approach to that based on their risk of both catching the virus and also being able to transmit needs to be factored into those decisions. So I can't promise you anything specifically, but certainly they'll all play a part.
Is this kind of work only for a relatively brief period of time? Eventually, once COVID's being managed in the community, it simply won't matter if you're vaccinated, unvaccinated, where you've come from, etc.?
It's a very interesting question and one I think we're all having a conversation about. I have not a very good idea at the moment about the time frame of our transition. Clearly, we will get to a point where there will be a degree of community transmission, and how that tends up and down, I must admit I'm not really sure. But there will come a point where we will have enough cases in the community that those coming in and out from certain areas, including potentially overseas arrivals, particularly from countries that have very low levels of COVID anyway at the moment. So it screws my head up a little bit sometimes thinking about all those factors and how they all come together. But you're exactly right. We need to start thinking about how many cases do we have? How much transmission do we have? Do these cases actually make a difference to our load or not? And that's the discussions that we're considering.
We've heard about a unit block in Braddon that has a high concentration of cases. Is there an update on that? Is there a cluster there? What's happening there?
Oh, sorry, look, I don't have any specific information on that at this time.
There was a large number of unlinked cases yesterday in that 41 update. Is there any update as to whether some of those have since been linked?
Look, I suspect some of them will as they went through the interview, but I don't have the details in front of me, sorry.
Yvette, if she's available. Thank you.
Hello again.
Hi. Minister Berry, what's the current vaccination rate among teachers?
The rate's going really well at this stage. Around 97% is the vaccination rate for our public schools. That survey that we've been conducting of our school teachers has till this afternoon before it's completed, and we'll get that data back tonight, as well as information from independent and Catholic schools, as well as the early childhood settings, and then we can see what the vaccination rate really looks like, or have some idea of what it's forecast to be. and then we'll have a conversation with the Chief Health Officer about what we need moving forward.
Just confirming that 97, was that first dose or second dose?
That's a combination of first dose, double dose, or booked in for a dose. Yeah.
Given those high vaccination rates, do you envisage it being appropriate or possible for individual parents to ask whether specific teachers are fully vaccinated before sending their child back to school?
I think that's probably a health question. People are entitled to their privacy around their own health records, but we're doing everything that the Chief Health Officer has advised us to do to make sure that schools are as safe as possible to mitigate those risks. Understand parents and young people and teachers' concerns. That's definitely what they expressed to us in the surveys that we did during the school holidays or just before the school holidays, with over 6,000 responses. And so what we've done is responded to the reasons how, what we're going to do to make it as safe as possible. And all of that has been based on the Chief Health Officer's advice. And, you know, we've all had confidence in Dr. Heron-Coleman in taking us through this pandemic up until now. As she's described, this is the transition phase, and so people will be feeling anxious, and it is a difficult time. So what we're putting in place now is all the measures that we possibly can to reassure people, take people through the detail so that they can feel as comfortable as possible.
It's a transition period, and one of the concerns and one of the big questions everybody has is what's going to happen when there is a positive case, specifically within a school. Do you have an answer to that as of yet?
Yes, so we've seen what happens over the last couple of years through the different variants of the virus on how we've responded. And so there's different ways that we've responded to that as a community. If a school is identified as an exposure site, then there'll be a response team set up into that school. Now remember, our school sites have a lot of information that they can provide to the Chief Health Officer and the health team that can really assist with that contact tracing. So they'll have site map plans, they'll be able to have rosters available of when breaks were happening, which students were in which classes, how the movement happened within those school communities. And now previously we saw that the ACT Chief Health Officer classified the whole school as a close contact location, but part of the plan going back to school is about keeping students and different age cohorts separate as much as possible, so the response might be different in those circumstances. We'll obviously be communicating directly with families on testing and quarantine requirements as that arises. And we're also looking at how New South Wales and Victoria respond to those circumstances should they arise, which might be different to the ACT. But, you know, we're all learning the best ways to do this, and so paying attention to what's happening everywhere else, we will. But we'll make sure the response is a health response and take the advice of the Chief Health Officer, but also communicating with our school communities every step of the way.
Will immunocompromised parents be supported to keep their children learning from home if they're concerned about their children bringing COVID back to their homes? And will students under 12 who are unvaccinated, whose parents are concerned about them contracting the virus at school, be penalised in any way if they do keep their children at home?
I think the best advice I can give is for those people to get in touch with their school teachers and their schools about what kind of support they can be provided if they, for whatever reason, make the decision that they need to keep their children at home. The education of those young people will be different to what they're experiencing now, because we can't expect teachers to provide both remote and on-campus education at the same time. That's just unfair of us to expect that of these teaching professionals. But what we can do is support those families to make sure that they and their young people are supported as much as possible. But I just remind everybody and provide that reassurance that all of the things that we're putting in place in our schools to make them safe have been based on the Chief Health Officer's advice and the AHPPC advice that this is the best thing we can do to mitigate the spread or the contraction of COVID-19 in our school communities. So please take that as a reassurance from the Chief Health Officer and the health experts that we're doing everything we can to mitigate that, and they should be reassured that it is as safe as possible. However, that's not to say that there may be an infection in a school community, But as I've just laid out, there are plans for managing that should that unfortunate circumstance arise.
And how concerned are you about the number of cases we're likely to see in schools in the coming weeks as we open up, given it will be the largest gathering, I guess, of unvaccinated people across the ACT in schools?
Yeah, sure. That's why we've put in all these measures to make sure our schools are as safe as possible, moving that fresh air through our schools, which is primary in mitigating the contraction of COVID-19, but also making sure that everybody's vaccinated. And that is the message we keep telling everybody every step of the way: get vaccinated to protect the people who can't yet get vaccinated. Of course I'm concerned. Of course everybody's concerned and worried about the safety and well-being of their young people in particular. But we're doing everything we can based on health advice to mitigate any risk, and we'll just keep going along together and providing reassurance to each other that we're doing the right thing. Canberrans' vaccination rates is incredibly high, and a real shout out to everybody for doing such a great job so far.
Are HEPA filters included as part of the funding for upgrades to school safety? And if not, why not?
So Canberrans will recall a couple of years ago during the bushfires, there were a number of HEPA filters that were provided, around 400